All right, so we're back again. Another video of the climb, and look who we have here. Familiar face, Alfred Venus.
Hello, hello.
Woo! Now we are side by side, but we're not crunched into one camera angle. And the audio, the video, all of it's better. So hopefully the experience with Al is even better than what it was before. So thanks for coming on, Al.
Of course. Thanks for having me. Hopefully, this one will be a little bit more polished up for us.
Yeah, a little bit polished up, tuned up to a different way. Um, so I wanted to bring on Al again because he is, actually been a role model to me. The way he takes on his medication, how serious he takes his routine, finding the right medicine. And I know it was a couple weeks ago I shared about me switching up medicine and trying to find that right mixture. And Al has always been someone that I've talked to that we could both relate to each other about finding the right medicine that works and being consistent to the process of that part of our own mental health. So Al, kind of just going off of the previous video, can you just share with everyone and your own journey of you coming across whether that's mental health medication or physical health and your history in the past?
Sure. They're obviously one and the same. I got diagnosed with a heart condition in high school, which led to me developing depression and anxiety issues. So it was a lot of different stages of medication and trial and error. So it started obviously with the heart medication, and then when I developed the depression and anxiety issues, you then had to kind of find a balance of medication that can help you
Hmm.
fight both issues, but also not fight each other. So it was a lot of coordination between doctors and a lot of note taking on my part to kind of dial in what was working and what wasn't in my day to day life.
Yeah, and for those of you that don't know Al too personally, personal, he was going through this heart condition early in high school, so he was thrown an obstacle that not even 30-year-olds or 40-year-olds have to go through. So it was not necessarily normal at the time for someone who is 16, going on 17, to deal with these types of health problems.
Of course, and with anything experiencing some kind of tragic diagnosis of that kind at that age, it obviously is a shock to your system. It's a shock to your plans. So, obviously you're looking forward to the future and what you want to do with your career and what you want to do in your life. And right in that moment, you're now having to navigate something that, like you said, a lot of adults don't even know how to navigate. So obviously it kind of throws you into a tailspin, and now you're at a very young age trying to figure out the right mix of medications to kind of bring you back to equilibrium.
Yeah, and I just remember like you going through certain things in life, but I've always remember how vulnerable you were to the situation, knowing that that was going to be the best for you, is to accept it with open arms, as unfortunate as it may have been. And that is something that, when I first, was suggested to take medicine, I was so resistant to it. Um, just because I didn't know much about it and I thought I could handle things on my own. But seeing you and going throughout the process, I know it's been hard for you too, to kind of accept the reality of, hey, this is my life. This is going to help me, and that being difficult. But I know that you've had a lot of strength and kind of showing that vulnerability of, hey, you know what, maybe this is going to help me out and be a better person and back to who I want to be.
Yeah, I think it's a lot of letting go of that ego aspect of it, because I think when you're young or just as you're growing up and you feel healthy, and there's this idea that, all right, I don't need medication, like I'm fine, I'm in good shape, I'm healthy, I'm feeling good otherwise, despite the depression or the anxiety. And you have this kind of, at least I went through this period where I felt like I could beat this. Like I can beat the heart condition, I can beat the depression, I can beat the anxiety. And you kind of have to get rid of that ego and just kind of come to terms with, listen, I'm presented with this chance to, you know, get help and use a tool in medication to bring me back to equilibrium. And I just have to kind of accept that and use it as a tool rather than look at it as a hindrance or something that I don't need.
Yeah. Yeah, and I think for most people, especially with mental health, it's comes down to a chemical imbalance. And when you describe it as that, I mean, I'll say it again, chemical imbalance. It doesn't seem like it's really your fault.
No.
And all you're telling me, I need to take this medicine, this little medicine to make me feel better, to make me whole. It's this really medicine is just like a salt or something for my head. Um, it really kind of wipes it away. And I always like to think about too, just the people that we may have gone to school with, or I've had played with sports, and you've played sports too, with people that had diabetes, and you go and it seems like every other person's on certain medication for their cholesterol, you name it. We get to a point where medicine is a necessity, but when at a younger age we think we're Iron Man and Captain America, and you don't need anything. So I think that's a
Exactly.
really good point.
You're invincible at that age in your
Yeah,
head.
yeah, and then that true strength, and I've said it before. That true strength is really your vulnerability. The vulnerability of like, okay, listen, like this doesn't make me any different as a person. If anything, it makes me stronger. If it needs to be something I have to take. So, no, I appreciate you sharing that. And one thing that I have always admired about you is your routine of finding that right mixture. You constantly are telling me, hey, I'm tweaking this, or I'm focusing on this because I'm not feeling well here, and I'm tweaking here, and it impacts here. And you're kind of like second level thinking of your treatment, which I think everyone should be doing. You shouldn't just imagine that you have a magical pill that's going to fix you for the rest of time. It takes that awareness, and I'm hoping you can kind of describe to everyone your process of finding the right medication, or maybe switching things up and kind of staying equilibrium through your physical and mental health.
Yeah, I mean, I appreciate that first and foremost. But yeah, it was something that I think is a benefit to me because I encountered these issues so young.
Yeah.
So it's just a matter of repetition, just like anything else. Practice makes perfect, and I think that once I got over that ego aspect and realized that, listen, if this little pill is going to help me be myself again and feel like me, why don't I try to optimize that feeling? So
Mhm.
I've always looked at it as, okay, what does my normal day-to-day routine look like, and how does this medicine either help or hurt it? And obviously,
Mhm.
there's always going to be drawbacks to medication, no matter how good it fixes a problem or helps you with a situation or a feeling. There's always going to be drawbacks, and it's just a matter of finding the right mix where there's less drawbacks and there's great reward from it. So it's a constant process of, like you said, tweaking it. If I find that down the road, maybe it's a year into taking a medication, hey, I'm starting to realize that it's not the right kind of feel for me. It's causing me to go off of my routine. It's inhibiting my normal activity. Now I've got to tweak it and make adjustments. So it's a constant, almost note taking process that I go on of just trying to optimize how I feel.
Yeah, and I mean, like I said, in these cases, you are a role model to me, because I have run into so much trouble just thinking that the medication I have is going to help me, and in most cases, that's not really helpful when I'm going through a manic episode, to think that, hey, my medicine is just going to keep me out of trouble. And of recent, I have been dealing with a lot of ups and downs and mood swings, of minor dissent. But I thought back to you're always tweaking things and talking with your doctor about, hey, this is good for me, this is not. And I thought the same thing, and I went over and I actually was prescribed my emergency medicine, and I had a very small dose that now I take every single day, and it's helped me. And I'm not sure if it's going to be good for another a years out, is things going to be different, but it is drastically really leveled my mood, which is huge for my diagnosis. And it all started from, hey, how can I tweak this? How can I make it a little bit better? Um, And you know what? I can't say it's too different from a workout routine. You know, if you're working out, you're trying to have gains, or you're trying to lose weight or do whatever your fitness goals are, sometimes it requires a little bit of a tweak to your routine, your workout, and that's what Al was talking about here. And I thank you, because without you, I don't think I would have been so receptive, to those changes.
No, I think you make a perfect point there. It's very much so like a workout routine in that it evolves over time. Just because one medication worked for you for 5 years doesn't mean that that's going to be the cure all for the end of your life, the rest of your life. So
Mhm.
it's something that's always evolving, and I'm happy to see that you've adapted a similar process in that you're looking to optimize how you feel on this medication because, like I said earlier, it's not a cure-all, but it is a tool, and if you learn how to use that tool to your favor, it can really help you rather than hurt you or be an issue.
Yeah. And you know what, Al? We work too hard to feel like shit, so we got to keep working at it.
Damn right. Damn right.
So, and I also want to say, full disclosure too, Al and I are very involved with our doctor. There's not anything we're self-medicating with. We're not stopping taking medicine unless our doctor's telling us to do it and how to do it. So, something, I think I saw from Al after my third hospitalization, his closeness with his relationship with his psychiatrist, and I was able to find that same relationship, and it's really crucial to be lockstep with your doctor, because they're ultimately going to be the ones to help you navigate this medicine, and unless you're willing to openly share what's going on and let them in, it's really hard to navigate those waters by yourself. So
Yeah, I agree with that wholeheartedly. I think that part of the medication conversation is, having that bond with your doctor, that you have that comfortability to have that conversation of, hey, I'm not feeling this medication, or hey, I think that I want to move in this direction. And if you have that relationship and that honesty, it's very easy to have that level of trust and bounce ideas off of the doctor and tweak your medication, because
yeah.
by no means do I think anyone should be doing it without a doctor side by side. And that's a very important aspect of this, obviously.
Yeah, it's huge, and I know we've said it before too. It really takes full commitment. You can't half-ass it. And I think in the near future, the episodes of Climb, we're going to talk about therapy, but you gotta find the right people to fill in your team, and that's why Team Garbo is a team. We have individuals that came to my side, but I consistently grow my team of doctors, psychologists, friends, families, loved ones. Who can help me? Who can I gain from? And even if you're alone on your own journey up this mountain that we all have, there are people out there that are willing to help you, and you have to be willing to help yourself by letting them in. So
Absolutely. Well said.
let's end with this. Give me 60 seconds or less. If you had a time machine and you could go back to 16-year-old Al, or someone is openly in front of you, Al, I'm going through some mental health issues, I'm thinking about taking medicine, or I'm going to take medicine, what kind of advice would you have for that 16-year-old person, or just in general someone that's new on medicine?
My first piece of advice would be to buy in. Buy in, like you said, wholeheartedly. Use it as an opportunity to optimize, not a negative opportunity of, oh, I have to be on something, I have to, I have to take it. Don't look at it as a negative necessity. Go all in and look at it as an opportunity to optimize how you're feeling. I think that's the first thing that I wish I would have done right from the jump. And like we said, the ego can get in the way, and your own thoughts of invincibility are hard to overcome at first, especially if you're in a transition age of high school into college. It's difficult. But if you can jump into it wholeheartedly and commit to dedicating your time to figuring out a proper mix of medication, I think it can set you up for success a lot more, and you can avoid a lot of issues down the road.
Yeah, no, that's really well said. Well, listen, I think that takes us to the time here, but obviously this has been visually a great experience bringing you back on, but I think we gained some really good stuff here, and happy to have you on board. And as always, I love you like a brother, and I thank you for so much for you opening up about this, because it's truly helped me, and I know it could help other people too.
Absolutely, man. Thank you for having me on again. I love you too, man.
All right, man. Until next time, thanks everyone.
See you guys.